Doctor, I am Yikho on behalf of the Wits Students Physician Society, and today we'll be uncovering on neurology. What is a neurologist?
So a neurologist is a specialist in neurological diseases, which include things like headaches, epilepsy, stroke, Parkinson's diseases, and just in general any neurological problem, to determine the cause in terms of the location of the problem and what the problem is. Sometimes muscle issues as well.
So then I would just like to know, how does one actually become a neurologist?
In terms of my journey, I took a break immediately after community service, and I was doing GP locums and casualty work for about 6 months or so. And I think I even worked in a mine, and then I decided to do anesthetics because I started doing anesthetics in community service. And then during the anesthetic time, I got a diploma, and then while I was doing anesthetics, I started looking into neurology because I had a friend who was in neurology, and then I decided to become a medical officer, and then I eventually decided to specialize in neurology. All you have to do is have your internship community service after the degree, and then you have to do 4 years at least for registrar time, and you can become a neurologist.
It's quite a journey. What is the difference between a neurologist and a neurosurgeon?
So a neurologist is a physician of the brain and the central nervous system, peripheral nervous system, whereas a neurosurgeon would be it's basically the surgeon for those systems.
What's a typical day like in your practice, as you can see?
So for me, my practice doesn't actually begin here in the rooms. It begins in the wards, where I do a ward round, and I see all the patients, hopefully both new and old, in the ward round. Sometimes I do not finish the ward round in the morning, and I have to continue it after I come here, and then I see the scheduled booked patients, new and old, and then I have to also do administrative work dealing with some of these patients.
And I see this administrative work is like a common term that comes through. So what does it detail specifically? Is it just
So details communicating to patients. I prefer emails, and then various forms, letters of motivation to the medical aides and whoever else needs it, and reports. Let's say today, I began at 7:30, and sometimes it starts at 8, and then I have booked patients from about 10 o'clock to 2 o'clock, just so that I can finish it at normal time. But sometimes it goes overboard because of the amount of patients in the hospital or the administrative work can do it.
And so what are the most common diseases that you encounter or diagnose or have to deal with your in and out patients?
So specifically in my practice, I have a focus of epilepsy and headaches, but I see all sorts of different problems. I think the most common problems are, two of them are epilepsy and headaches in any neurology practice. I think Parkinson's disease is fairly common, and stroke is another disease. Myasthenia gravis, peripheral neuropathy, all of these different diseases could be part of the neurology practice.
What are the general challenges that neurologists face in South Africa?
It differs or changes according, if you're in state or in private practice. In state, it's whether or not the different departments can do the investigations and tests that you want them to do. In private practice, most tests and things can be done, but it requires medical aid authorization or funding from the patient, and that can be challenging. So I think it is different. There's some resources not present in South Africa. But in general, our system and what we can offer to the patients, I think it's on an international level.
Then how many neurologists are here in South Africa?
It was a little over 100, but I think there's more now.
How has the COVID-19 pandemic really affected your practice holistically, you know?
So in terms of my life, the teaching thing was one of them. In terms of the practice itself, initially the outpatients, and even during waves, it's the same kind of thing happens. Many people tend to cancel, many people don't show up, or they, and then there's a hesitancy to be admitted from patients. Even patients with severe problems that need to be admitted, some of them, not all of them, but some of them don't want to be admitted because of the fear and paranoia.
Is the mask then the impedance, the whole thing?
So sometimes if I don't need to remove the mask, I won't. But then it's obviously I'm not covering all the cranial nerves. if there is a need based on the history and the patient, then I will ask them to remove the mask and examine them. There's also more of a platform for video consultations, which was not actually part of this practice before the COVID-19 and has since become a part of it. Since the focus of my practice is headaches and epilepsy, there's not so much of a need for examination in such conditions. So for the video consultations, I only see follow-up patients as video consultations. I do not see new patients, so it works out.
The skills, like personal skills, you know, apart from academics, that one needs just in order to become a neurologist, that you think are not they're very important, they play a huge role.
Compassion is a good skill. I don't know if you call it a skill, but I think you use
it's an attribute.
So
sorry,
we'll run with that.
Personal attributes,
yeah,
I think.
So compassion, problem solving is very important as a neurologist specifically, and communication.
Any tips that you have for medical students, just like myself and my colleague here?
So I remember when I did medicine in 4th year, 5th year, I remember reading this
Tadiwanashe,
yeah, and there was the neurology section, so it was pretty good, and it made me interested in neurology at the time, even though it was like way too much compared to the other sections.
I don't know, Ashwin?
I can confirm that. It's a very heavy section.
Oh no.
But that's the beginning in terms of the examination, and the history is the basic core of neurology. And even though we have access to various types of investigations such as MRIs, CTs, EEGs, various pathological things for blood and CSF, the core of neurology, of medicine, is the clinical examination of history and examination.
More than anything else, it's just been an honor and a pleasure to interview you, Doctor. And any closing remarks from your side?
I just want to encourage the students that watch this that neurology can be difficult in terms of some of the diseases that are not easily treatable, but there are a lot of rewarding experiences in terms of there are treatable conditions like the ones that I deal with, epilepsy and headaches. You can get someone headache free, and even though many doctors do not like dealing with headache patients, once they're headache free, it's very rewarding to hear how it's changed their life. And so the same thing with epilepsy. Those kinds of experiences can enhance job satisfaction.
Did you know that the average ear is approximately 6 centimeters long? And did you know that each year you get a new ear canal? The skin in the ear canal grows approximately 3 centimeters a year and pushes out the old skin. Just like trees!